Hi Lisa, I'm traveling overseas with study abroad, and I was told I need to come check in on some health issues, and they said to come talk to you. Um, can you help me with what I need to do to be healthy overseas?
Yeah, it's real important to see someone when you're traveling overseas, because there's a lot of risk factors that some people are completely unaware of when they travel to other countries. And so it's good to come and talk about those risk factors. Important thing to know is where you're going to go, what you're going to do, who you're going to stay with, how long you're going to be there, because those things are all extremely important factors in what kind of health issues and safety issues that we need to talk about.
Okay. And what about just basic health, like vaccines and things like that? Do we get these done here at CSU?
Yeah, absolutely. We have a full-service travel clinic here at CSU Health Network, and what we do is we talk to you about the places you're going to travel, and we also talk to you a little bit about your past medical history and encourage you to think about that with travel, because that's another important thing. We also look at your vaccine history, and we try to make sure you're up to date on your routine vaccines, like your tetanus shot, and also advise you based on CDC recommendations about what vaccines the CDC recommends for the certain destination you're going.
Excellent. So the CDC has a lot of information. Is there another place we can go as well, like the State Department?
Yeah, well, the CDC has excellent information on travel health and vaccinations and safety and stuff like that. The State Department has an excellent website that people can go to and look up safety issues. What countries have travel warnings, what countries have travel alerts where maybe there's something going on in the country, an election or military coup or something like that. Okay. People need to know about before they travel to a country.
So my advisor also asked me to request information about travel insurance. Can you tell me a little bit about travel insurance?
Yeah, well, travel insurance is really important to have because, of course, if you go overseas and you get injured, you want to know that you can be taken care of. So you should check if you have your own travel insurance, if you have your own medical insurance, whether or not it's going to work in a foreign country. If you don't, then you need to look into some form of medical insurance, and a lot of travel agents can help you with that. STA Travel is really good. We also highly recommend a student ID card called an ISIC card, International Student Insurance Card, that not only has some medical coverage, but it has coverage to help you if you lose your passport and other things like that. So I highly recommend that for students. It's real inexpensive and worth it.
So do you have any advice? Like, I'm under the care of a physician right now that's checking over my things. So far as prescriptions go, do you have any information that I should be aware of?
Yeah, what we like to tell people is that we encourage them to come in and talk to us about the risks of travel. However, if you're under a care of a physician, you want to go talk to your physician about your medical condition and make sure that you, number one, are stable enough to travel, but also that you have all the supplies you need when you're traveling. What we don't want to see is someone that's just starting a new medication right before they leave to go overseas because they will be so far from their doctor. We don't want someone to finish a medication they've been taking a long time right before they travel. We want someone to feel pretty stable, that whatever they're taking is going well, and that they have enough of it to take while they're traveling. There's also other things, like if you're taking any controlled substances, or if you're taking anything that uses needles, you probably want a note from your doctor that says why you're taking those medications. There's a few drugs like Adacel that's used for ADHD that are considered controlled substances in some countries, and so you need a note from your doctor to take them in.
So do you have any other just general health tips for traveling overseas, ways to stay healthy so I can enjoy the trip more?
Well, there's a lot of ways that people become injured or sick. A lot of times it's from whatever they've ingested food, contaminated food or water. So that's kind of a good thing to keep in mind for most countries you travel to, is you want to make sure your food's well cooked, the water's safe to drink, and that's some of the research that goes into planning a trip as determining that type of thing. Insect bites can also produce a lot of illness, especially in some countries, and so knowing those risks and then also preventing the insect bites is really important. So depending on where you're going, that's really important to know. Safety is really important because a lot of times you're going places where you can't just fit in and people don't notice you. You'll stand out as an American. People may see you as being wealthy and may, have ideas that you've got a lot of money on you. So there's really some important things to think about there. I usually advise people not to be alone, and especially after dark. A lot of crimes are committed against travelers where there's alcohol involved, and probably because people feel that people who've had some alcohol are a little bit more of an easy target. Also, people who do a lot of drinking sometimes make some poor decisions and get themselves into situations that are very dangerous. Along those same lines, some of those poor decisions involve sexual contact, and a lot of countries have a lot of problems with sexual diseases that people need to think about and protect themselves. We even go so far as to advise people to perhaps take their own condoms with them if they're going to certain countries to make sure that they have the protection they need if they're going to make decisions like that.